Hi everybody, welcome to another biology presentation. So in this presentation, we are going to look at how we can answer multiple choice questions based on health and diseases. So let us now look at question 1. So here is our question 1. What is the best definition of good health? A, the absence of any physical symptoms. B, a state of complete physical, mental and social well-being. C, having a normal body temperature and blood pressure. D, the ability to perform daily activities without fatigue. So the best definition of good health is a state of complete physical, mental, and social well-being. So the correct answer here is C, a B. We now move on to question 2. So our question 2 reads, which of the following is not typically considered a component of maintaining good health? A, regular exercise. B, balanced diet. C, adequate sleep. D, constant medical checkups. So we are looking at which of these is not typically considered a component of maintaining good health. So regular exercise is considered, balanced diet is considered as a component of maintaining good health, adequate sleep is also considered, constant medical checkups is not typically considered as a component of maintaining good health. Yes, we can visit the clinic or the hospital for medical checkups, but not constant medical checkups. So the correct answer is C, a D. So we now move on to question 3. The question reads, what is the primary difference between infectious and non-infectious diseases? A, infectious diseases are always more severe. B, non-infectious diseases are always genetic. C, infectious diseases can spread from one person to another. D, non-infectious diseases only affect older adults. So the primary difference that exists between infectious and non-infectious diseases is that infectious diseases can be transmitted from one person to another, while non-infectious diseases cannot be transmitted from one person to another. So the correct answer here is C, a C. We now move on to our question 4. The question reads, which of the following is an example of an infectious disease? A, type 2 diabetes. B, influenza. C, Alzheimer's disease. D, hypertension. So the best example of an infectious disease from these that were given, it's influenza. So the correct answer is a B. We move on to our 5th question. The question reads, non-communicable diseases are also known as dash. A, chronic diseases. B, acute diseases. C, contagious diseases. D, parasitic diseases. So non-communicable diseases are also known as chronic diseases. So the correct answer is A. We come to our question 6. The question reads, which factor is mostly likely to contribute to the spread of an infectious disease? A, genetic predisposition. B, poor sanitation. C, lack of exercise. D, high cholesterol levels. So we are looking at the factor that is mostly likely to contribute to the spread of an infectious disease. So the factor is C, poor sanitation. So this one, it's mostly likely to contribute to the spread of an infectious disease, because we have said these diseases are transmissible from one person to another. So if you are not keeping the environment clean, these diseases can be easily transmitted. So the correct answer is C, B. We now move on to our question 7. The question reads, what is the term for a disease that affects a large number of people in a given area at the same time? A, pandemic. C, endemic. C, epidemic. D, outbreak. So the term that is given for a disease that affects a large number of people in a given area at the same time is called the epidemic. So the correct answer is C. We now move on to our question 8. The question reads, which of the following is not a common type of non-infectious disease? A, cardiovascular disease. B, cancer. C, malaria. D, diabetes. So the correct answer here is C, malaria. So malaria is not a common type of non-infectious disease. We now move on to our question 9. The question reads, what is the primary mode of transmission for most infectious diseases? A, genetic inheritance. B, environmental pollution. C, pathogens such as bacteria, viruses, or parasites. D, lifestyle choices. So the correct answer here, we are looking for the primary mode of transmission for most infectious diseases. So the correct answer is C, pathogens such as bacteria, viruses, or parasites. So pathogens are organisms that causes a disease. Okay, so the correct answer here is a C. We now move on to our last question, which is question 10. Which of the following is a key strategy for preventing the spread of infectious diseases? A, increasing sugar intake. B, avoiding all outdoor activities. C, practicing good hygiene and hand washing. D, consuming only processed foods. So we are looking at the key strategy for preventing the spread of infectious diseases. So we have to ensure that we practice good hygiene and we regularly wash our hands. So the correct answer here is C, a C. So thank you so much, everybody. We've come to the end of our presentation. This has been your presenter, Mr. Mlenga. Bye-bye.